When we're assessing testosterone to the question of the labs, the first crucial thing is you can't just test testosterone. It exists in a system. You have to look at all the aspects of the system that we can. Second is testosterone has a normal daily rhythm, and all the normal range numbers are based on first thing in the morning. So if you measure it in the afternoon, it's always going to be low compared to the morning because it should be. That's normal. In fact, if it's not doing that, that's a whole other problem. So 8 a.m., 9 a.m., that's your window to get testosterone measured. If you measure it any time outside of that window, the numbers, we don't actually have ranges. We don't know what they mean. So I see that all the time. That's a trick, unfortunately, that a lot of these testosterone clinics use. They measure at the wrong time, and so then everyone looks low. Then everyone gets testosterone, and they're always like, see, we told you this is super common, and it's like based on fraud, just straight up fraud.
Well, hello there. I'm Dr. Kate Kresge, Head of Medical Education at Rupa Health. And today's episode is a great one. We're talking with Dr. Eric Yarnell, who's an expert in men's health and urology. In particular, he's really skilled at using herbs and natural interventions to help improve things like low testosterone, prostate issues, fertility issues, and more. He gives us a masterclass today on how to boost testosterone levels naturally, what a comprehensive and accurate testosterone panel actually looks like, what you can do if you have conditions like prostatitis or even interstitial cystitis, which can cause a ton of pain in your pelvic floor. He gives us so many practical, tactical strategies and so much hope. I know you're going to love learning from him today. Before we get started, though, I want to talk to you about something that comes up pretty often on this podcast, and that, of course, is lab testing. You see, lab testing is one essential way to find the root cause of an illness. If you're a practitioner, chances are you're ordering a ton of different labs with a ton of different companies. This podcast is created by Rupa Health. Rupa is the #1 way to order, manage, and track results from over 30 different lab companies in one single place for free. Thank goodness, no need to create and log into multiple portals ever again. If you're a practitioner, make sure you go sign up at rupahealth.com today to create your free account and start saving time and moving faster in your practice. While you're there, you can check out our free tools like the AI meal plan generator and lab shops, which help you grow and scale your practice faster, harnessing the power of technology. Dr. Eric Yarnell, welcome to the Root Cause Medicine podcast. Let's dive in here because we get asked this question more than almost anything else. So let's start with, what does testosterone do? What are some of the symptoms you'd have if it's low? And then I do want you to go into actual lab parameters because I think that is a really critical conversation we're not having with people.
So critical. So testosterone, wow, it does really many things. And that, I think this is another internet-based problem where you can get really dazzled by the physiology. It's like, oh, wow, testosterone affects probably just about every system in the body. Therefore, it explains everything. It's like, no, we could also say that about thyroid hormones. We could say that about cortisol, our stress hormone. Yeah, hormones are signaling and telling all over our body what to do, but they're working together. So you can't just isolate that one problem. So that's another internet advice problem. It's like, yeah, if you may know a lot about testosterone, but if you don't know anything about the thyroid or these other hormone systems, you could misdiagnose someone who actually has low thyroid and they have all the symptoms that look like low testosterone, and it has nothing to do with testosterone. So some of those, for example, a symptom could be basically depression. But that could be due to all kinds of things, right? It's not just low testosterone. So that's where you have to do what's called a differential diagnosis. Like you have to figure out where that symptom's from. Just because people have a set of symptoms which matches this, there's still probably 10 other things it could be, and you have to know all of them. Otherwise, you're going to be misled. So lower energy, and I've seen that manifest as low motivation. But yeah, just literally like not wanting to get up. So clearly the testosterone works in the brain. That's part of what it does. And when it goes to the brain, that's one of the places where it gets turned into dihydrotestosterone, which is like a really, really strong form of testosterone. And that's important for that libido, for that interest in sex. The other big place that conversion happens is the prostate. But the brain and the prostate are taking the testosterone, making it into super testosterone. So that tells us like they really need a lot, and it has a big impact there. So this actually is another place where testosterone therapy is a really tricky, because it tends to stimulate the prostate to grow. And that's often guys that have low testosterone, they also already have an enlarged prostate, and that becomes a whole can of worms. But another place I think, which is really surprising, I probably should have led with this, is testosterone is hugely necessary to make sperm. In fact, almost all testosterone goes to that. The amount that ends up in our blood is less than 10% of the total amount that's made in the testicles. So almost all that gets grabbed by this thing called androgen binding protein and used to make sperm. So very small decreases or increases in testosterone can totally shut off sperm production. Too much or too little, boom, infertility. Another side effect of testosterone replacement that no one talks about, and especially if, if you think maybe I want to have kids, you got to really watch out for that. Thinking of a patient who he was older, so there's also this assumption like, well, if you're over 50, you're not having kids. Pfft, come on, that is not that uncommon anymore, right? And so this guy wasn't told that when he went on testosterone therapy, what could happen. So he was infertile for 2 years, even after he stopped. Like, it took 2 years to recover his sperm production, so which he did, thank goodness. Obviously, testosterone is necessary to maintain and to some level to build muscle, but it's not that simple. Again, there are many things that play into that. And then sometimes you might notice like my beard growth is really slowed down. Like, it's like I hardly ever have to shave. That could be another clue. Again, could be other things. Now, of course, the opposite's true with losing hair on your head, right? That actually is like testosterone actually drives that to happen. So losing hair on your head, no, that's not a sign of low, but not growing a beard, again, the rate of it is more related to a lower level, potentially. So when we're assessing testosterone to the question of the labs, the first crucial thing is it's not just, you can't just test testosterone. It exists in a system. You have to look at all the aspects of the system that we can. Second is testosterone has a normal daily rhythm, and all the normal range numbers are based on first thing in the morning. So if you measure it in the afternoon, it's always going to be low compared to the morning, because it should be. That's normal. In fact, if it's not doing that, that's a whole other problem. So 8 a.m., 9 a.m., that's your window to get testosterone measured. If you measure it any time outside of that window, the numbers, we don't actually have ranges. We don't know what they mean. So I see that all the time. That's a trick, unfortunately, that a lot of these sort of testosterone clinics use. They measure at the wrong time, and so then everyone looks low. Then everyone gets testosterone, and they're always like, see, we told you, this is super common. And it's like based on fraud, just straight up fraud. Yeah. So also, there's not just testosterone. So testosterone is carried around in the blood by different proteins because it doesn't really dissolve in water. Our blood is mostly water. So a little tiny, tiny bit of it is floating around free, but most of it's being carried by two proteins, albumin, which is the main protein in the blood, and this thing called sex hormone binding globulin. Well, it turns out the sex hormone binding globulin grabs the testosterone and it basically never lets go. That testosterone is gone. Your body cannot use it ever. Eventually, it will be broken down with the sex hormone binding globulin in the liver. And that's it. It's gone. So the fraction your body can use is the part that's hooked to the albumin and that's floating around free. So those two together we call the bioavailable testosterone. That's the test you really want. If all you can get tested is the free, I mean, you always get the total, so all of them. So you need that. But if you can at least get the free, that's important. But if you're not measuring that albumin bound fraction, you're missing like 40% of the available testosterone. So you really need the bioavailable testosterone, is what it's called. Some labs will call that the weekly bound testosterone. So you order the free and the weekly bound. So those are all crucial. And another little side note is we have the absolute numbers of those, but we also know kind of the percentage that those should be of the total. And even if that's not reported, it's a simple division problem to calculate that. So the next most important piece is the luteinizing hormone. So this is a hormone that's made in the pituitary in the brain, and it was actually named after the role that it has in women. But in men, it is the hormone that tells the testicles to make testosterone. You always have to measure that because the testosterone might be low because the brain signal isn't coming, isn't right. That's actually way more common than the testicles can't make it. And so again, you don't test that, the testosterone looks low, it looks like you should have testosterone, but that could just be the absolute worst thing because the fact that basically the pituitary is like the thermostat of testosterone production. So the brain is monitoring how much testosterone, how much is needed, what's going on. And basically that testosterone feedback inhibits the brain. So if already the pituitary is not making enough luteinizing hormone, and we'll talk about why that would be, and then you put more testosterone in the system, that actually tells the thermostat to shut off even more. And that makes the problem worse. You're not fixing anything. You're making it worse. So then we actually also can measure that level of the sex hormone binding globulin because there are conditions that will cause that to go up. And it's basically soaking up the testosterone. It's not that you can't make it. It's not that the brain signal isn't there. It's that it's getting soaked up. And finally, we generally want to also test the total estrogens. I've also seen some people that only test the main estrogen, which is estradiol, but there's a whole bunch of other ones. So you really, really want the total so you see the whole picture because, of course, one thing our bodies do with testosterone is turn it into estrogen. And sometimes that system is out of whack. And that's kind of where the problem is. And that's another place where testosterone therapy can become a problem because you could be just feeding testosterone into the estrogen, which a lot of people know that happens through this enzyme called aromatase. So some people will talk about you're aromatizing the testosterone, whatever. So several tests are needed to figure out what's going on with this complex, super complex, widespread acting hormone.
So you mentioned sperm production, and I want to get into that because another thing I heard you say in another interview was in fertility treatment, we tend to focus so much on the person in the relationship who has the ovaries and the uterus, and men are often ignored and left out of that conversation completely. Can you talk to us about the conversation that could or should be happening?
By all accounts, we know right off, of course, if one partner or the other has a known problem, of course, focus on that. But when there's no known problem, you should always start with the sperm former because the workup is way less invasive, it's way less expensive, and about half the time, that's where the problem is. For a long time, people are like, well, it's maybe 60-40, like it's a problem with the person with the egg versus the person with the sperm. No, it's really clear. It really is about 50-50. And there's actually some overlap where both have it. But yeah, so because we're talking about basically semen analysis, and honestly, depending on that, it tells you whether to do a hormonal workup. the only way testosterone being out of whack, usually low, is causing infertility, you'll see there's a really low sperm count. Any other abnormalities, it's not about testosterone. So that could save you a whole bunch of money and workup. But the problem with that is sperm or semen analysis is really bad. It's really flawed. We're starting to see that because we've done so many studies now where they thought, okay, we can see the sperm are malformed. They're not moving well, or they're not enough. Oh, okay, we're going to do treatments. Oh, look, those things got better. Now we're going to have a baby. Nope. So more and more we're starting to see that actually the analysis we can do on the sperm misses most of the problems, which are in the DNA. And the conventional semen analysis doesn't look at that. So the sperm may look completely fine. It can move. It's regular as one tail. It doesn't have three tails, all those things. But if the DNA is damaged, you don't get a baby. So even though I'm advocating doing this workup, the reality is the workup is flawed. Now that's starting to change because finally we're starting to see, those parameters aren't the crucial parameters. It's actually, we need to do these DNA analyses. So there's a whole bunch of tests that are starting to come out to look at that, but it's still too early to really know what's going to be the best. So I expect there's going to be a big change though in the next 5 to 10 years as those tests are developed and proven to be more useful. So this is also a huge warning when you look at the research on anything, whether it's supplements, herbs, drugs, surgeries, anything that have to do with male factor infertility, and all they report is that the semen analysis got better. That research is useless to you. If they don't report pregnancy rates or live birth rates, and almost none of them do because that's way more expensive to do those studies, but those are the only studies that matter. The goal is not to make the semen analysis better, it's to make a baby, right? So you have to measure the right outcome. And since we now know those semen tests don't predict who's going to have a baby and who isn't, that's not really that useful. So a lot of times now we almost always have a semen analysis. I'm saying it's fine that we want to improve that, but really, if you and your partner don't get pregnant, we haven't succeeded. And really, I'm much more saying those parameters on the semen analysis don't actually tell us what to do. We're just going to focus on your general health. Unless there's no sperm or very, very low, then we're definitely doing a hormone workup because low testosterone will cause that. Yeah.
So we mentioned that full testosterone panel, right, where you're looking at other biomarkers other than just the total T and free T. Are there additional biomarkers you would add on for someone who does come in and says, we did my semen analysis, it was normal, or maybe it wasn't normal, but now it is, and I've had my T checked? What are some other things we haven't mentioned yet that you would be looking for to help them boost their fertility?
So there's such a huge answer to that, which is we're seeing some of the consequences of our chemical society. This is one way that toxicity expresses that is actually turning out to be really, really common, that chemical companies are not required to test for this, so they release all these molecules that cause problems. So, oh gosh, where to even start with that? Anyway, so yeah, and that makes the workup really difficult because there's literally thousands of chemicals that are a problem, and you can't test for most of them. So I recommend that people get at least sort of the main pesticide and herbicides that we can test in the blood. We're starting to have assays for things like bisphenol A and some of these forever chemicals that have been talked about more recently, the PFAS and other molecules like that, things that are called PCBs. Even though some of those like PCBs are essentially banned, but they last forever. So the stuff that they made millions of tons of in the 60s is still all over the place in the environment. So, and really the ideal test there is actually a fat biopsy because most of these chemicals are fat soluble. They're not actually floating that around in the blood because they can't. They don't dissolve in water, so they go to our fat tissue. And there's an amazing study that they did in Seattle where, and this wasn't about fertility, but it illustrates the point of, they had researchers standing outside of a conventional grocery store in Seattle, and then they had a researcher standing outside of one of our co-ops, and they basically asked people if they would come to the lab and do a fat biopsy to see, like, what is your pesticide load? And they eventually got enough people, and they showed, no big surprise, the people shopping at the co-op, eating more organic food and things, had way lower pesticide levels in their fat tissue than the people that were shopping at the conventional grocery store. So again, they weren't looking at health outcomes. They were just saying, clearly your exposure is different whether you eat those chemicals are in larger amounts versus way lower amount.
That's good news for everyone at home who feels like they've spent a small fortune on organic foods. Because like every so often, somebody comes out with an article in a magazine that says like organic doesn't matter, and there's a whole uproar, and it's usually clickbait. And it works really well because people get really upset thinking like, shoot, does it even matter that I'm eating organic? But studies like the one you just mentioned.
Right. Most of those studies, they're just analyzing the amount of a nutrient in the food. It's like, that's not the only issue here. It's not only about how good the things are present, but how many bad things are present. And a lot of those, I mean, gosh, the literature on Parkinson's disease and those chemicals is really scary. And like most people were like, we don't know what's causing it. I'm like, I think we have a pretty good idea. So you are doing yourself a favor. It is preventative. Keep it up as much as you can.
So if you find those, first of all, even without testing, I think it sounds like we can assume if someone's not eating organic, and if they live in the US, they probably have some form of these chemicals. What's the treatment protocol that you advise people to do to get those out?
So in my opinion, I'm in the gentle detox camp. So there's other people that are in we're going to start injecting you with chelating drugs like DMSA, and we're going to soak all this stuff. And that, great. I don't know. I don't know what's best. But what I know is when you do a more aggressive approach, you're actually re-poisoning the person. Like you start pulling it out of the fat, it goes into the blood, you actually start exposing them more. So I'm worried about that. But we don't have great studies to guide us. So I don't want to say that's bad, you should never do that. It's just, I have concerns. Maybe ask some questions, who knows?
And the American College of Toxicology generally recommends against chelation for a number of known toxins, even low levels of lead, because it comes with risks. And some of those risks are that it can pull really good minerals out of your body, along with causing your body to dump those toxins at higher concentrations into your blood. And if your detox pathways aren't ready for that, which is usually part of the underlying root cause of why you're toxic in the first place, then you can create more problems. So you're not alone.
I appreciate that. So I tend to use sauna and hot tub, sort of, which we know are just really slow ways to get it out. But in this case, slow is important for reasons we've just discussed. And then, it's more about like, stop putting more in. And basically, I don't know do herbs help or not. We really don't know. There's a lot of hype around various things. There was like a craze for cilantro, which was based on nothing. There's just no clear support. Certainly not like a human clinical trial that definitively shows, like, no, there's like one animal study. It's very minimal. So I don't think those things are harmful, but we just don't know. That's where we're at. So yes, do I give people things like dandelion, like really gentle so-called liver herbs, like that are mildly moving, like they help to make more bile, so the bile can help carry some of these things out. But I don't promise like this will absolutely remove all of this from your body, like, because I don't know that. So that's kind of the direction I go.
Yeah. You mentioned you'll talk about some herbs or even plant foods. And I'm wondering, besides dandelion root, even just other like fiber rich foods, when people ask you, how do I eat to optimize my detox abilities? What do you tell them?
The reality is humans are situational omnivores. We will eat whatever is available. What drove us in food is not starving to death. If that meant eating pine bark, you ate pine bark. If that meant eating insects, you ate insects. If that meant eating antelope, you ate antelope. If that meant eating tubers and nuts and beans, so we can eat anything. Look, our digestive tracts are amazing. Though we shouldn't eat plastic, even though we can, and we do. I do think we have a problem with too many grains. Grains are amazing. It's just the problem is that grains have led us to actually have really non-diverse diets. So I try to get people's diets to be more diverse. So it's like bring in more fruits and vegetables of more kinds. Like those have the water-soluble fiber that we're really lacking, that our good bacteria really want, that really feed them, and that do bind up a lot of these toxins and prevent them being absorbed and slowly help pull them out. Because another thing is, if you use something like dandelion, and so more bile, that's bringing out more of the compounds, those could get reabsorbed too. And that's a function of gut bacteria, how well your digestion's moving. So we also, another thing I treat all the time is paleo, like meaning high animal product, low fiber diets and constipation. It's like, great, now you can't excrete those toxins efficiently through your stool. Like that's really terrible.
Because you are such an expert in herbal medicine, I want you to tell us, like, what are some things that actually do work to help people optimize their testosterone production if they're in a male body, that are safe? So maybe when they are talking with a professional and they hear that professional say these same herbs, or they get prescribed a product with these herbs in it, they can know, like, okay, these are legit. I've heard about the evidence for these.
I kind of can't answer that exactly as you asked it, because again, there are different reasons that testosterone might be out of whack. So I'm going to start with this most common cause, which again is this, that the LH, that brain signal, isn't getting made. Like there actually isn't enough testosterone, but the brain thinks there is. And usually what's underlying that is either pre-diabetes or diabetes, because those conditions are not just a condition of high blood sugar, those are conditions of systemic inflammation, where basically the blood vessels are damaged all over your body. They're releasing cytokines, which are these molecules that tell your immune system, come and fix me, but also trigger all these problems. And those cytokines also trick your brain. And we don't exactly understand why your body wants there to be less testosterone when there's chronic inflammation, but that seems to be the pattern. But anyway, high blood sugar and these cytokines, this systemic inflammation, suppress this. And I'm seeing more and more people that it blows my mind. They're athletic, they're moving regularly, they're eating when I read it, it's like that. They tell me it's like, this looks like a pretty darn good diet, but they're pre-diabetic. And more, we're seeing it's because we're back to this chemical toxicity thing. I hate to be a broken record, but a bunch of those chemicals, turns out, make your body not listen to insulin. Like they cause diabetes and they cause obesity, and they're called diabesogens because that's a really good name. So it may be nothing you're really doing. It really can be outside factors. So even if you think, there's no way I could have that, you got to test. So especially if you've got low testosterone with a not high luteinizing hormone, like if your testosterone's low, your brain should be screaming, make more, right? So that LH should go up. So if it's not doing that, so then we start talking about, for example, one of my favorites again is cinnamon. Like that's an herb that helps your cells to listen to insulin, to take that sugar in, to process it. And so basically we're going to lower the blood sugar, but there's so many herbs to do that, it's crazy. An herb that's kind of a little bit faddish now to help with testosterone, that actually I think it works because of this helping blood sugar thing, is fenugreek. So there is a little bit of evidence in one setting that fenugreek might raise testosterone. And that setting is in older men like in their over 65, there is some evidence of mild testosterone increases with fenugreek in not just one study, but like 2 or 3. Though we also see that in women that are older. So that's interesting. But fenugreek is also a very traditional herb for diabetes. We have probably better research on other herbs, but it looks pretty good that, yeah, it's a mild insulin sensitizer, we say. And, oh gosh, there's, for example, the herb called bitter melon. We got to come back to the bitters, which is an Asian really vegetable, but you can take in a capsule because I don't know, for me, its bitterness is just in a way that's unpleasant that I've never gotten used to. It just never tastes good to me. But it is eaten as a food in many places in Asia. So that's a nice one. And then we have that inflammation. So again, none of these are like testosterone boosting herbs. These are like, we're going to the root. We're going to help your brain. Yes, we're going to help your brain to see the true state of your testosterone. So probably the most famous would be turmeric to help reduce inflammation. I don't know, maybe. And that I have a whole other soapbox. Are you ready? So we know about turmeric because it has been a food, a medicine, a spice for more than 10,000 years. Like before the ability to write down history, before writing was invented, this was a domesticated plant that was eaten by huge numbers of people every day. So, and it's what's called the rhizome. It's not the root of it, but whatever. That if you've ever seen turmeric or ginger, it looks just like that. That's what people are. Well, now all of a sudden, though, more and more companies are saying, no, you know what? We're just going to take out 5% of that, which is this fraction called curcumin, which is this one small amount of it. We're going to throw everything else away, and we're going to tell you that's better. And you know what? It's not. There's no way 95% of this plant that we've used forever is useless. The one thing that's in turmeric that is a problem is it is loaded with oxalates. So some people, the way they metabolize those, they can get kidney stones. They can get this disease called interstitial cystitis. So there's a small percentage of the population that really wouldn't be a great thing for them. Though the other thing about turmeric, it was really often taken with milk, which of course is high in calcium. And the calcium binds the oxalate. Like there's almost always a reason that we can figure out in modern times, like why is there this traditional practice? So it's like they really figured that out. So like curries with cream. Now again, if you can't tolerate dairy, that's fine. You can use, of course, green vegetables have lots of calcium in them, or you could take a calcium supplement. Like 200 milligrams of calcium blocks like 80% of oxalate absorption from food. So it's not hard to do that. Anyway, the curcumin might be useful in that case, but anyone that's selling you curcumin, they're not doing it based on a clinical study comparing this tiny fraction to the whole plant, because that's never been done. And that's just like research 101. If you want to show your products better, you have to compare them head to head. And no one's ever done that. That tells me right away that there's a problem. So eat whole turmeric. You can add it to just about any vegetables in the world. It tastes good. You can control the spiciness by what you mix with it. Turmeric is really not that spicy. And if you really don't like it to eat it, then there are capsules of whole turmeric. You don't have to only take curcumin. So please, whole herbs, not drugified pieces of herbs.
What are plant medicines that help optimize production of hormones?
Yeah, for that, I generally turn to what are called adaptogens. And these are also immunomodulators, but these are herbs that we know are really safe to use for long times. They're tonics, and there are some that are really traditionally famous in men. And so 2 of those would be Panax ginseng, or the Asian ginseng, or red ginseng. It's got a lot of names. And then also the ashwagandha, which these are kind of interesting because in some ways they're opposite each other. So ashwagandha is, I would say, more cool. It's more relaxing. Its Latin name is Withania somnifera. That somnifera you might recognize from the Latin meaning like sleep. So we actually do use it to help people sleep. Like it's calming versus the Asian ginseng is more stimulating. It's not anything even like caffeine. It's not like you take ginseng, you're like, whoa, I could take it speed. No, it's more in the direction of boosting. So once in a blue moon, someone will take it and will feel overstimulated. They might actually have a little trouble falling asleep. Then that's actually telling us you probably shouldn't take that herb. You should actually switch to the ashwagandha. So if you have that happen, listen to your body. If you take the ashwagandha and you feel like you're a zombie, you're sleeping all the time, you're tired, that's not right either. Your body's telling you no, and maybe you want to switch to that ginseng. And again, these are the kind of things like we as trained practitioners, like we know and we can help you with that. But you can also listen to your own body, of course. So, but both of these, they're kind of optimizing lots of systems in your body. So your immune system, so that could affect the inflammation going to the brain and to the testicles. They both help your blood sugar. And it's not that you're even pre-diabetic, but boy, we want to make sure you don't head in that direction. So there's lots of ways indirectly that they can help. And there's, again, a little bit of evidence, again, mostly in older men, of actual production increases, mostly with the ginseng. Really, if you're a young guy, you're probably not going to see a big boost from any herb because you really don't need it. If you are in the low end of the range, that's normal. I just can't say it enough. Like I see that all the time. I've seen guys that are truly, totally healthy. Yes, their total is in the low end of the range, but that's just the low end. That doesn't mean it's the bad end. And that's looking at the whole panel. It's like their LH is perfect. Their total is low, but then they're low normal, but then the free and the bioavailable are perfectly fine. So yeah, we have to watch out for sort of, I would call that testosterone anxiety. It's actually kind of misplaced, and that really those other things that you're doing to be healthy really are important, and that is keeping that system in balance. But yes, anyway, these adaptogens or sort of tonics are good because one other influence on this system is stress. And we need stress. So first, I don't want to demonize stress. Like we need stress to be alive. Like it's a little stressful just doing anything, right? That's fine. The problem is we've created all this chronic stress that we can't do anything about. Like you're reading the news, you're like, oh great, another war. I can't do anything about that. It's stressing me out. Or just driving in traffic. We get used to it, but it's actually kind of stressful to have multi-ton metal machines going 80 miles an hour all around you. So, yeah. So all of that has a very mild but cumulative kind of negative effect, and these herbs help offset that. And that includes almost certainly hormonal effects. I want to make another point here, which is that low testosterone is often a symptom of something else, right? It's not actually a disease. Your body is responding. And so, again, the really good example of that is your blood sugar is kind of creeping up, starts affecting the luteinizing hormone. And so the testosterone is a symptom that your blood sugar is creeping up. The problem is dealing with that. Giving testosterone is never going to fix the blood sugar problem. You're off the base. So it's really important to know, like, now, there are diseases where literally the cells that make testosterone are either destroyed or they're not there. Then low testosterone is a disease. But that's maybe 10% of all the guys with low testosterone. So that's pretty uncommon. It's mostly a symptom. It's really secondary to something else. So we always are thinking about that.
And guys, we'll talk about some case studies if you're up for it, but I'll tell people on the Rupa magazine, you guys can go Google Mike ADHD case study, Rupa magazine. And what you'll find is one of my case studies where we're actually treating someone for their ADHD. They came in and said, I'm on the max dose of stimulant medications. I'm not getting as much impact as I need. I still can't concentrate. Can you help me with my mood and my focus? And as a result of building him a really nutrient replete meal plan, that contained adequate amounts of protein, stabilized his blood sugar, getting him sleeping, reducing his stress, fixing nutrient deficiencies and food sensitivities and leaky gut, his testosterone jumped several hundred points. And he wasn't taking hormones or herbs. It was straight up just like what we call foundations of health, using health to help heal his symptoms. And so I want you to go read that because you'll see the numbers. And I think it's just really nice to see the proof. And also we put in there, I think, how much it cost him total to do all of this and how long it took. And like, it was really inexpensive, right? And he didn't need like shots or pellets or creams or anything. So it's truly possible. And do you have a favorite example of this, Dr. Yarnell, that you like to share to kind of show people how powerful this can be?
Yeah, this was a good case that kind of showed me exactly what you're talking about. So I was seeing this gentleman, early 50s, 54, 55-ish. But he was actually coming to see me for a condition called Peyronie's disease, which is a disease of the penis that basically there's scar tissue that forms so the penis can curve. It can be very painful. And so he was having that. But his issue was where the scar tissue was, it was kind of like in a band. So he actually couldn't really get an erection past that band. So it was like literally like half an erection. And he had a fiance, like they were really struggling sexually, but also he had pain with erection. So there's a great herb called gotu kola that helps to change that scar tissue. It's just slow. It takes a few months sometimes for it to work. So he was using a cream of that. But he's like, in the meantime, we were kind of looking at his other health issues, and he had fatigue. He's like, I'm losing interest in my job. I'm bored. We started doing other workup, and eventually we did look at his testosterone panel. And yeah, he had this kind of mild, normal LH, low testosterone. Like he was officially low, but his brain was like, it's fine. I don't need to make more. Like, I don't need to tell you this. So, but all I did was had him shift to a more plant-based diet. So it wasn't like you have to be vegetarian, but his bride-to-be was actually Vietnamese. So they eat meat in Vietnamese cuisine, but they eat a lot more vegetables. So I'm like, you know what? It's time just to eat a Vietnamese diet. Like just eat way more of those vegetables and actually, and let's just have maybe less beef and pork and a little more chicken and fish direction. And his fiance was totally excited by that. That's great because he really had been tailing off in his exercise too. So we're like, let's just get you back to more walking. What can you do together with your fiance? Do you guys like to go hiking? Do you want to go rowing together? And I don't remember. They figured something out that they like to do together that was moving their bodies. So it wasn't exercise. It was actually fun. And we had him do the ashwagandha, because it also did seem like his sleep wasn't the best. And in 3 months, the Peyronie's was completely gone. Now, he was using the cream, which I've seen the cream do that. So that was part of it. But his testosterone, his LH, everything re-regulated. His interest in his job came roaring back. It was actually a problem because they actually started having sex multiple times a day because it was like making up for lost time. Like he actually went too far and actually re-injured the Peyronie's, and it came back not as bad, but yeah, it's like, oh no, I never thought to tell him to not go too far too fast because I didn't expect this was going to happen. I mean, it was so incredible. He was transformed in 3 months into this different person. He felt so good. And yeah, again, no drugs, minimal herbs. Same thing. Like I want to go and like add up. You're like, how much did he spend? A lot of people get a little sticker shock because it's like you have to pay cash a lot of times to see a naturopathic doctor. You're like, whoa, that's expensive. But actually, if you add up your insurance premium that's going to pay doctors thousands of medical doctors, thousands, it's actually a really good deal. But yeah, the total cost is way better. So anyway, he was thrilled, and yeah, it was amazing.
Well, I mean, think about, my brother's a personal trainer, and he brought this to my attention one day. He's like, you go into GNC and everything that's being marketed specific to men usually is like high octane. Like there's a guy with a blowtorch and he's like humongous and he looks angry. And it's like this idea of like gently boosting your chi sometimes does not enter the conversation. It is this very like hardcore, let's go, push it to the max, when we know that that can come with some major side effects. And this is a really safe, gentle protocol that will truly work.
And if it doesn't work, that also tells us, okay, there may be something more serious going on here. Let's start looking, again, now let's start looking at the thyroid. Let's start looking at these other systems. Or is there an actual diagnosable disease that we missed or that just hasn't become completely obvious yet? Yeah, so there's a lot of reasons for that. And this brings up this whole idea of using the least force necessary, right? You don't open your door with a crowbar and a sledgehammer because you can just turn the handle.
What are the dangers of having testosterone that's too high?
So one that I run into, I mentioned earlier, is causing the prostate to enlarge. So you get or aggravate this condition called BPH, or benign prostatic hyperplasia. In the extreme, that can kill you. So if it's blocking your ability to empty your bladder all the way, you can get infections in your bladder, you can get infections in your kidney, or the urine can back up into your kidneys and they can actually shut off completely. I've actually had 14 patients now in 30 years. It's not that common, but 14 that they were in acute kidney failure because their prostate was enlarged and they really didn't know. No one had told them. And those weren't due to testosterone. There were a couple where they were taking testosterone. That was a factor. But that can happen even without it. But anyway, I've had quite a few. So there is some concern about it causing prostate cancer. I think most of those concerns have been discounted in studies. So if you are low and you're raising your levels to a normal range, that doesn't probably cause cancer. But yeah, if it's going high, that's concerning. And yeah, but if it happens, aren't you going to wonder, like, God, did I cause this because I was pushing too hard? Like, oh my gosh, and now you've got a potentially deadly disease. So those are concerning. But yeah, definitely the emotional lability. So often the way it's presented is the patient's like, I'm more or less fine, but often they have the partner's there. Maybe it's their wife, maybe it's their girlfriend, whoever, and they're like, you're pretty moody. You've been kind of losing your temper lately. You know, like it's not all the time, but it's more, you may not even be that aware of it. And others around you might. So you might go back and just ask people like, hey, I'm just curious. Does it seem like I'm being more moody or aggressive to you? And you might be surprised. People are like, yeah, I didn't know how to tell you because it wasn't terrible, but it is noticeable. And just being honest with yourself. That's what I really want to promote is, yeah, I understand you might really believe in this testosterone thing and you might be right, but you have to be realistic too, that there is a way to do it right. And maybe that's not it. And if you are overdosing, that it's not all or nothing. It might just mean you need to change the dosing or change the dose form. There's a lot of strategies. It's not a zero-sum game where it's like, well, then you have to stop it completely because you're having complications. But again, that infertility thing I want to highlight, you wouldn't necessarily know that, and it may not be an issue right now, but what about in 2 or 3 years you decide you want to have kids and it's like, oh boy, I have no sperm because I'm taking testosterone. And that happens even if you are low in testosterone and you're taking a reasonable dose, it will still completely shut off sperm production. It's just, which tells us a little bit about the fact that any way we give testosterone replacement is not physiologically the same as your body making it, right? To me, the obvious one there is this circadian rhythm, that daily pattern I mentioned. Like there's basically no form of testosterone that can mimic that. If you do the shots or the pellets especially, your levels go way above that and they stay way above that. You don't have any daily rhythm. It's always too high. And we have no idea what that does. Like no one has studied what are the implications of not having the daily rhythm of this hormone that you've had for all the rest of your life, right? Like to me, that's a really big unknown that's scary. But the closest would be the creams where you can apply it And it does, but it still pretty clearly doesn't give you exactly a daily rhythm. But I do tend to try to start with the creams, which have their own problems and they don't always work and there's issues, but at least we can mimic that daily pattern the closest, and really only go to shots if you absolutely have to, or pellets, because you're guaranteed wiping out that rhythm.
Thank you for giving us so much time. We have to have you back to talk more to us. Talk to us about the prostate. What have we not covered that you're thinking hold on a second, I want more people to know about this because I feel like it's missed in a lot of conversations about men's health?
There's a disease of the prostate that has no name, a condition where there are cells that under the microscope look like cancer, mildly, but they don't spread, they don't metastasize, they don't cause any symptoms, they never hurt you. So we also know this happens in a fair percentage of what's called breast cancer. The cells look abnormal, but they don't ever actually do anything harmful. A lot of thyroid cancer doesn't spread, doesn't do anything. There's all sorts of skin cancers that aren't harmful. So the melanoma is real dangerous, but there's what's called basal cell carcinoma, but that almost never hurts you. So calling those cancer is a big problem because that word is very triggering, right? Everyone is very afraid. Oh my gosh, I have cancer. I'm in big trouble. Well, not for this. And that fear of the word cancer is leading people to have their prostates taken out or radiated with no benefit. So they did this huge study in the United Kingdom with 1,600 men, a huge study. So they all had this low-grade abnormal cells that, I don't think we should call it cancer. So this is expressed in the prostate. They had what's called a Gleason score of 3+3 or 3+4. So very mildly abnormal looking under the microscope. So a third of them, they randomly took out their prostates. A third of them, they had radiation treatment. And a third of them did nothing. Now, I want to highlight, they didn't change their diets. They didn't take supplements. There's a lot you could do. But they did nothing. And they just published the 15-year follow-up of these guys. How'd it go? And the answer was doing nothing was as good as taking out your prostate or having radiation. There was no survival benefit. Everyone lived just as long. There was way more side effects if you had your prostate out or radiation, of course, way more side effects. There's none from doing nothing. So this is to me, and this is called the PROTECT study. This is the icing on the cake. This proves this is not cancer. Cancer kills you. Now, a small number of men died in all three groups. I'm not saying it was none of them. So some of them had an early stage that became cancer. And some people are saying, yeah, there was more cancer metastasis in the do nothing group than the other two groups, but they didn't die. Their death rates were the same. So, well, maybe there was, but that actually raises the concern that the treatments cause somewhat more death that offset the deaths from the cancer in the no treatment group. Anyway, that's getting a little esoteric. But anyway, so what's really becoming our tool to figure this out, people may know about the PSA blood test as a screening test, but that can't differentiate this dangerous kind of prostate actual cancer from this not cancer, we don't know what it is stuff. But the tool that's looking better and better to do that is an MRI. So you can do an MRI of the prostate. It has to be a 3 Tesla MRI. The Tesla is the unit of strength of magnetic fields. This has nothing to do with the car company. They're named after the same famous inventor. So it has to be that strength MRI. A lot of older MRIs are 1.5 Tesla, and they can't do this. They're not good enough to see the prostate, which is pretty small. So that gives us this score. It's called a PIRAD score from 1 to 5. And it's really only the 4s and the 5s that there's any chance it's this really aggressive, dangerous kind. And then that would be followed with a biopsy, but they can just target the places the MRI shows as a problem. So now we're talking about a couple of needles instead of what they used to do was like 12 or 16, like, let's just go randomly look all over the prostate. We don't need to do that anymore. So this is way less invasive, way more effective. So it's really been quite a change in practice. But anyway, if you have that low-grade stuff, changing to a more plant-based diet, some very simple herbal things, immune strengtheners, some mushrooms, not the psychedelic kind, but the shiitake, like the food kinds, can really stop that from progressing, and it's really, really effective. That's about a third of my practice is dealing with that situation. It's really common. So the other area, and again, if you have the higher grade, truly prostate cancer stuff like that, that is really benefited by conventional treatment, but combined with the natural treatment, that's even better to help deal with side effects and to make it work even better. The other thing I want to mention is chronic prostatitis. So this is actually also a very, very common and the least talked about of the prostate problems because it's less understood. But this is a condition that causes pain. Every other prostate condition doesn't really do that. So if you're having any pain, so it might be pain when you're peeing, it might be pain just all the time. Sometimes when you're sitting, sometimes it's like just in your pelvis, it's dull, or it's in this area that's called the perineum, which would be that place like from the base of the penis to the anus, like in between there. That sometimes hurts. And yeah, so if there's pain, it's almost certainly not cancer. So that could be a relief because sometimes I think those things get connected in people's minds and it scares them. But one of our biggest problems with this is most clinicians are treating this literally in the way that it was treated in the early 1900s. There's been no change in practice, which is that it's on the assumption that it's an infection and that you treat it with antibiotics. And that almost never works. It's not an infection. It's not an infectious disease. There's a small fraction where it is, but a lot of these antibiotics relieve pain, and therefore everyone thinks, oh, that must prove they're treating an infection, but they actually just treat pain and inflammation separately from their killing bacteria effect. So especially the Cipro-type antibiotics, fluoroquinolones, are clearly also anti-inflammatories. So this is a complex condition. There are lots of things that could be going on. Again, it's like, what's the root cause? Sometimes it's actually a muscle and ligament problem. So basically all those pelvic organs are sitting on what's called the pelvic floor, a sheet of muscle and ligaments and tendons. And those sometimes are spasming. And it's really, you need physical therapy. We do what are called sit spas to like relax the muscles. So that's like 20% of the time it's a musculoskeletal condition. It's not a prostate problem at all. It's just like the muscles pinching the nerves going to the prostate and causing pain. And then, but a lot of times it's this very complicated scenario where the problem actually starts in the gut with leaky gut. That's, I'm sure you've talked about many times on here. And then that leads to people becoming sensitized to things they're eating, like food molecules going through those leaks. That triggers their immune system to become overactive. And for whatever reason, your immune system decides, and the prostate is part of the problem, we're going to go and trigger pain and inflammation there. So the treatment is of the gut to help the prostate symptoms. And that's by far the most common manifestation of that disease, which is like in conventional medicine, if you just talked about that, they would say you're crazy. They don't even know anything about that. But the evidence is just getting stronger and stronger and stronger that that is true. So anyway, finding a practitioner that knows anything about this disease besides just giving you antibiotics upon antibiotics is a big struggle. And knowing it's a process to figure out what is it and how to treat it is really important.
If the treatment is just health enhancing and there's very low side effects, then it is okay to presumptively treat. Like, it would be a different story if you were going to do a really high force intervention that had a ton of side effects. Like, you'd really want to know. But I want you to talk about the treatments for leaky gut, because I think people are going to hear them and think like, oh, that sounds kind of nourishing and healthy and nice.
And yeah, really, to me, the crucial thing first is you have to find what's going through the leaks and stop them. Because when molecules from foods or the gut bacteria go through the leaks, they make them worse. They're not just walking through a doorway. Now it's a bulldozer driving through a doorway. So that really, I believe, requires what's called an elimination challenge diet. And it's not that the food's unhealthy and the food didn't cause it. They're just by chance going through these holes that have opened up. So that really requires switching to eating foods you never eat, like switch to completely different foods. And that's actually become really easy. We have so many more options available to us. And this is only going to be for a short while because this is a test. This is not really a treatment. It's both. So you switch to eating completely different foods. So I do that for 2 weeks. And again, I call it also an adventure diet. It's like time to try new things. Let's try a whole bunch of different foods I haven't tried before and see. You may not like them. Fine. You're not committing to anything. And then you start bringing one food back at a time. And what'll happen is if it's going through those leaks, it will trigger the symptoms. So once you've eliminated all those foods, then what I found most helpful to actually seal up the leaks, now that they're not constantly being aggravated, is aloe gel, not the laxative part of it, then glutamine, the amino acid. And I've had some success with calendula, but that's an herbal medicine. That's been less obvious and consistent. But yeah, really just those two things, glutamine and aloe gel, has been kind of amazing. I'd say a minimum of 6 months, even though the healing starts before that, but you really want to be sure that they're as fixed as they can be before you start bringing back some of those foods that challenge positive. Let's say you reacted to wheat. You're not then going to start having bread every single day. It's like just have a small portion, see how you do, wait a couple days, make sure the leak is fixed. If you start to get some pain, it's like, oh, the leaks aren't really fixed. But one thing I want to highlight is not to avoid these foods forever. Like that does actually increase your sensitivity to them. It is important to try to get back to eating the foods. Now, we're not talking about, again, recipes like ingredients, and you should still eat them in their healthiest whole form as much as possible. But yeah.
I love that. It's so interesting. Hearing you describe that, it actually sounds a lot like the treatment for interstitial cystitis.
Yeah, same. Almost, it really, I think, is the same condition. We usually don't know if it's the bladder or the prostate that's being affected, but yeah.
So this has been an amazing talk. Thank you so much for spending so much time with us. I just want to ask you, what do you want to leave our audience with today?
It's a little bit where we started I really want to make it clear. I don't want to stop people from researching their own health. I want to actually encourage that intensely. I just want you to realize that you can't just take the information at face value. You have to know the source and look at multiple sources that are different from each other, because sometimes one source is citing another source, which means that's like one echo chamber. You got to get out of that. If no one agrees with them, then you have to start to wonder, well, what is this based on? But anyway, do research your own health. Just do it wisely. Take your time, but also get professional consultation, because the internet doesn't know you. You're just an anonymous, right? You need to have someone that knows your whole story that can help you get guidance, and that there really are many solutions and options that aren't presented as such in conventional medicine. That is part of the picture, is where are the strengths of the two systems and how do I work together with those? Research wisely, take charge of your own health.
It's great advice. And someone who's not only going to work with you, but who's going to really look at your comprehensive picture and then keep up with that picture. I think what a lot of what we talked about was how do you do the workup, but as you guys are doing a lot of the interventions to fix whatever you find with the comprehensive panel that Dr. Yarnell talked about, you should get that run again, or at least parts of it run again, so that you can monitor how are things working. That very evidence-based approach is what you're talking about, which I so appreciate about you. So thank you so much for being here with us. We will have you back.
Thanks for having me.